If probiotic meant one treatment, the supplement aisle would be simple. It is not. One video says reset your gut in a week. Another says most bottles are hype. Before we argue benefits, what is the first filter that keeps a buyer from treating every capsule like the same medicine?
Start by refusing the single pill story. NIH Complementary Health Guidance defines probiotics as live microorganisms intended to have health benefits when consumed or applied. They show up in yogurt, fermented foods, capsules, and even beauty products. Live and intended to help is the category. Proof for your symptom is a narrower claim. The practical filter is strain identity. Lactobacillus or bifidobacterium on a label is like saying antibiotic without naming the drug. Bifidobacterium longum BB 536 is not interchangeable with a generic bifido blend, and one Lactobacillus rhamnosus product is not automatically another. Evidence travels with strain name, CFU target, and the endpoint researchers actually measured. A recent athlete trial makes that specificity concrete. Male athletes eating high protein plus BB 536 did not show clean between group wins across every gastrointestinal outcome. Diarrhea-related scores and some odor-related metabolites looked better mainly in microbiota-defined subgroups. That is a subgroup signal, not a universal gut pill.
So does my starting microbiome decide whether a bottle is even worth trying? In the Akkermansia study, low baseline levels seem to matter. How is a normal shopper supposed to use that without buying a stool test?
You usually cannot map intratype in the aisle. What you can do is choose a strain study for your exact complaint, then judge that complaint. Mechanistically, many products behave like temporary ecological nudges. While present, they interact with resident microbes, barrier signals, and immune communication. Permanent colonization is not the default promise.
Where do yogurt and fermented foods fit versus capsules? If I already eat yogurt most days, am I covered, or is a studied supplement a different tool entirely?
For many adults, the most defensible everyday lane remains selected strains around antibiotic-associated diarrhea and some digestive contexts. That is much narrower than Balance, your microbiome wellness copy. A product that helped one endpoint cannot be generalized to bloating, immunity, mood, sleep, and metabolic health as a package deal. Newer headlines need the same discipline. In older adults around an mRNA COVID booster, 2 Lactobacillus strains did not change the proportion without detectable anti-S1 RBD antibodies at 6 months. In metabolic syndrome, pasteurized Akkermansia MUC-T did not beat placebo on the primary Matsuda insulin sensitivity endpoint. Exploratory branches are interesting. They are not settled aisle benefits.
Those null primary endpoints almost matter more than the hype. Are you saying a thoughtful buyer should treat no difference on the main outcome as a real answer, not as a study to ignore?
Exactly. Benefit hunting should stay attached to the measured outcome and the people enrolled. Low baseline Akkermansia responders, athlete intratype subgroups, or specialty nutrition settings can change the odds. They do not turn a bottle into general wellness insurance for every gut.
Before product labels, who should not treat a probiotic as a casual wellness add-on. I keep thinking about severely immunocompromised people, premature infants, and anyone with a central line. Those groups are not the same as a healthy shopper grabbing a bottle beside the vitamins.
Those are hard stop or clinician-first situations, not fine print footnotes. Live microbes are the point of the product, so infection risk matters when host defenses are fragile or when product source and quality are uncertain. For everyone else, the common startup issue is milder. Gas or bloating can appear as the gut adjusts, which is a reason to start one product thoughtfully instead of stacking several bottles at once. Outside those high-risk groups, better fit users often have a concrete stressor. Athletes under high protein or ultra-endurance load are a clearer lane than vague wellness. Sleep-focused probiotic and symbiotic trials in exercise people lean toward better perceived sleep quality and sometimes latency, but the evidence base is still small and adjunctive.
In the ultra-running paper, did Lactoplanobacillus plantarum 299V actually protect the kidneys, or was the signal more about the gut? I do not want race recovery myths getting ahead of the biomarkers.
Product quality is the quiet half of the benefit question. Colony-forming unit counts only matter if enough organisms survive storage and stomach transit. Heat, moisture, and expired labels can erase a beautiful strain story. Prefer products that name the strain, state CFU through end of shelf life when possible, and come from a source you can evaluate, because dietary supplements are not held to drug approval standards.
What about probiotics during or after heavy antibiotics in really sick people? I saw a sepsis pilot comparing a probiotic regimen with fecal microbiota transplant. Is that something someone should copy at home after a routine outpatient antibiotic course?
Correct. Critically ill, transplant, and complex kidney care settings are research or specialist lanes. A symbiotic trial in overweight or obese kidney transplant recipients lowered markers linked to intestinal permeability and inflammation, which is intriguing for cardiovascular and graft risk biology. It is not a green light for unsupervised supplement stacking after transplant. If infection risk is high, you have a central line, or immunity is suppressed, get clinical guidance before live microbes.
For a generally healthy person with one clear complaint, how should they judge whether a probiotic is helping without turning it into endless bottle hopping?
Pick one matched outcome, give it a fair window, and keep everything else stable. The chronic kidney disease low-protein diet work with Lactoplanobacillus plantarum W gel shows what precision use looks like in research. It helped counter nutritional stress signaling without erasing the diet's metabolic benefits. That is a targeted tool inside a medical nutrition plan, not a reason to buy WJL for vague gut optimization. So the durable takeaway is match, verify, watch, and ask. Match a named strain to a real complaint with human evidence. Verify the product can plausibly deliver live organisms. Watch that one outcome instead of chasing wellness vibes. And ask the clinician first when immunity is fragile, infection risk is high, or care is already complex. That is probiotic literacy without the magic.